I'm a second year PhD student in the Department of Sociology here at Durham University. I'm also co-supervised in the sport department because my primary area of interest is physical activity. How can we get the population of the UK more interested in physical activity, exercise and sport for the benefit of their health? The main project that I worked on at Public Health England was a big systematic review of reviews of digital health interventions. Digital health interventions are things like social media, the internet and apps. How could we use these to increase people's physical activity, reduce the amount that they smoke and drink, and also look at their diet? How could they lose weight using these interventions? So we collected all of this stuff together and presented our findings based on how effective these are for those outcomes. We did this with the health checks team. So this was a different team within Public Health England who oversee GP practices health checks, which are free for 39 to 74-year-olds to go and have an MOT on their health, essentially. So how could we use these apps to help promote the behaviours that they were interested in to reduce cardiovascular disease? On a day-to-day basis, the placement was very similar to any other office job. We'd work from 8 till 5, 9 to 5, depending on the day. We'd come in, we'd have team meetings. But I think where it was different is we'd go off and do our own individual projects a little bit more often and work on our own based on our interests and our relative expertise. So we may only come together once a week, in some cases once every 2 weeks, to discuss projects, how they're going, and share it with the team. There were three key things I think that I did day to day. The first of which was around evidence use in those policy processes. So it may be something like the big evidence review I've spoken about, or more rapid reviews for different parts of government, or even different teams within Public Health England. An example would be when the Environment Agency came to us and asked, how can we use behavioural science to reduce the amount of coal and wood that people are burning in their homes? The second key thing is evaluation. We run a whole range of behavioural science interventions and we were evaluating how effective are they. Sometimes that was experimental, sometimes it was using qualitative research to find out about that. That might range from anything to do with antimicrobial resistance or reducing the amount of antibiotic use, or something as simple as trying to reduce the amount of sugary snacks that we're putting in children's lunch boxes. The third thing for me, I think, which was different to a number of the other members of the team, is very early on I was trained by Public Health England in data protection, data management and data anonymisation, and I became sort of the team's advisor on really ensuring that we met the rigorous standards of data management for use of data with third parties. So we'd give things to universities for further evaluation, or even just sharing our data with another team in Public Health England.